America's healthcare system is one of the most advanced in the world, but also one of the most expensive. From rising prescription costs to hospital bills that can bankrupt families, millions of Americans are asking the same question: will healthcare ever get better or just worse? But behind the chaos, a transformation is quietly unfolding. AI, telehealth, wearable tech, and political pressure are reshaping the future of how we live, heal, and survive. In this video, we explore what's next for US healthcare and how it could change your life in the next 5 years. Stick around because this is not just about medicine, it's about your future. The US healthcare system is often praised for its advanced technology, top hospitals, and cutting edge research. But behind that progress lies a painful truth. Healthcare in America is broken for millions of people. Let's start with the biggest issue: cost. The United States spends more on healthcare than any other country in the world. Yet, millions of Americans struggle to afford even basic medical care. A single emergency room visit can cost thousands of dollars. Prescription drugs are so expensive that some patients skip doses or avoid treatment altogether. Then there's the issue of insurance. Despite the Affordable Care Act, nearly 30 million people still don't have health insurance, and even those who do often face high deductibles, co-pays, and confusing plans. Many people don't fully understand what their insurance covers until they get hit with a surprise bill. Another major challenge is inequality. Access to quality healthcare depends heavily on where you live, your income level, and your race or ethnicity. People in rural areas often have to travel hours just to see a doctor, and minority communities face higher rates of chronic illness and lower quality care, a problem that worsened during the COVID-19 pandemic. And finally, there's the issue of mental health. America is facing a mental health crisis. From depression and anxiety to addiction and suicide, millions of people need help, but mental health services remain underfunded and hard to access. Long waiting times, high costs, and social stigma prevent many from getting the care they desperately need. So, when we ask what's next for US healthcare, the answer depends on whether these deep-rooted problems are finally addressed or allowed to get even worse. While the US healthcare system struggles with cost and access, one thing is certain: technology is changing everything. In the coming years, we're going to see a major digital transformation in how Americans receive medical care, and it's already begun. First, let's talk about telemedicine. During the COVID-19 pandemic, online doctor visits became a necessity, but now they're becoming the new normal. Patients can talk to doctors, get prescriptions, and receive follow-up care all from their phone or computer. This is especially helpful for people in rural areas, seniors, or anyone with mobility challenges. It's convenient, time-saving, and often cheaper than an in-person visit. Next, there's artificial intelligence, or AI. AI is now being used to analyze medical scans, detect early signs of cancer, and even predict health risks based on patient history. AI-powered tools can help doctors make faster, more accurate decisions, and in some cases, catch diseases before a human doctor even notices them. Another major breakthrough is in wearable technology. Smartwatches and fitness trackers are no longer just about counting steps. They can now monitor your heart rate, sleep patterns, oxygen levels, and even detect irregular heartbeats. This data can be shared with your doctor in real time, allowing for continuous care, not just treatment after something goes wrong. Robotics is also advancing. Robotic surgery, for example, allows for more precise and less invasive procedures, which means shorter recovery times and fewer complications for patients. In some hospitals, robotic assistants help deliver medication, monitor patients, and support nurses, especially during labor shortages. Lastly, electronic health records are making it easier to store, share, and update medical information between different providers. This helps reduce errors and ensures better coordination of care, especially for patients who visit multiple doctors. All of this points to one thing: technology is making healthcare faster, smarter, and more connected. While technology is transforming the tools we use, the system itself still needs major reform, and that starts with policy. For decades, Americans have debated one major question: should healthcare be a right or a business? On one side, there's a growing movement for universal healthcare with proposals like Medicare for all. Supporters argue that every American deserves access to healthcare regardless of income, job status, or zip code. They point to other developed countries where citizens enjoy affordable or even free medical care and wonder if they can do it, why can't we? But on the other side, critics worry that such plans could lead to higher taxes, longer wait times, and government control over personal health decisions. Private insurance companies and many politicians push back hard against universal models, fearing it would put them out of business. So far, what we've seen is small steps, not big leaps. The Affordable Care Act, also known as Obamacare, helped millions get insured, but it didn't solve the root issues of high costs and complex coverage. Now, there's new momentum for change. In recent years, both Democrats and Republicans have introduced plans to lower prescription drug prices, especially for seniors. Some bills aim to limit how much drug companies can charge, while others focus on increasing transparency in hospital pricing so patients know exactly what they're paying for. In 2022, the federal government passed a law allowing Medicare to negotiate drug prices directly with pharmaceutical companies, something that was previously banned. This could save billions of dollars and set a new precedent. Election years often bring healthcare into the spotlight, and in 2024 and beyond, voters will likely demand answers. Will Congress finally agree on a bipartisan solution? Will the next president support bigger reforms? Or will the healthcare system continue to favor the rich while the average American struggles to pay a hospital bill? One thing is clear: policy reform isn't just about laws, it's about people's lives. And the pressure to fix the system is growing every single year. So, with all the problems and all the progress, where is US health? The future is full of uncertainty, but also opportunity. Let's start with the most hopeful outcome. If technology continues to evolve and if smart policy reforms are made, we could see a system where healthcare is more affordable, more personalized, and more accessible than ever before. Imagine a future where you don't have to wait weeks for a specialist because AI tools help diagnose you in minutes. You don't need to drive for hours because a virtual doctor's visit is just a tap away. Your smartwatch alerts you to early signs of illness and your doctor contacts you before symptoms get worse. Your medical records are centralized, error-free, and available to any hospital you walk into instantly. All of this is possible, and in some places it's already happening. Healthcare isn't just about hospitals and doctors. It's about families, futures, and the kind of country we want to live in. Whether you're hopeful or worried about what's next, one thing is clear: change is coming. The only question is, will it work for everyone? If you found this video valuable, don't forget to like, subscribe, and hit the bell icon for more eye-opening content on the issues that truly matter. And let us know in the comments, what do you think is the biggest challenge facing US healthcare today? Thanks for watching, and we'll see you in the next video.